Dr. Vivek Murthy, the United States Surgeon General, joins us now. Doctor, thanks for your time. This booster
of course, it's good to be with you, Kelly.
It's good to have you. So this booster is the exact same shot that people got last time. It's not tailored to COVID Delta. Are you confident that this shot will make a difference? And why do people have to wait 8 months to get it?
That's a good question. The plan that we announced today is a plan for booster shots that will begin 8 months after your last shot, and this program will start on September 20th. But here's a critical thing for people to know. Number one, the vaccines are working, and they're very effective in preventing hospitalization and death in particular, the worst outcomes with COVID-19, and we still feel good about that. That's why we're not advising people to go out and get boosters today. But what we are doing is we're looking ahead. We're looking at where the data is, where the trends are leading, and our concern is in a few months' time, we may see an increase in breakthrough hospitalizations and deaths, again, based on the trends. So we put our heads together, the top public health and medical officials in the Department of Health and Human Services, and came to the judgment that starting booster shots at that 8-month mark would be the prudent thing to do to stay ahead of this virus and make sure people have and continue to have the protection from the vaccines that they've had over the last few months.
We had Dr. Vin Gupta on this news hour last night. He disagrees with this guidance, especially as it applies to everybody, because he says the current data shows the 2-dose vaccines are effective at keeping people out of the hospital, healthy adults. Here's his concern.
This will cause potentially confusion. It's going to cause people who've been fully vaccinated to say, wait a minute, I thought I was protected. And crucially, Carl, for those that are unvaccinated, it's going to cause them to say, well, are the vaccines working or not?
What's your response to that? And do you have any worries about this messaging and how it might potentially, worsen the battle with vaccine hesitancy?
Well, Dr. Gupta is right that we have to be very clear with people about what these boosters are for. And here's what I would make sure that everybody understands. Number one, the vaccines are working. They're working very well. And what we want to do is make sure that continues to be the case. But we know with our experience with other vaccines that immunity does wane over time with other vaccines, which is why we give boosters. It's a very common thing to do with other vaccines. And in this case, it is no different. Because we were seeing the protection start to reduce across the population, across age groups, is why we made a recommendation that at the 8-month mark, all adults 18 and up should get the booster shot. Now, this is going to be contingent on the FDA's independent evaluation of the third dose. It'll be contingent also on the CDC's advisory committee weighing in. But we are making plans now because, number one, you got to plan ahead. But two, we wanted the public to know what we were seeing in the data in our effort to be transparent and open with the public.
At the same time, a lot of workplaces are already mandating that employees get vaccinated. So now, what would you say to a CEO who's wondering if they should also mandate the booster shot?
Well, in my mind, this doesn't change, actually, what workplaces are doing, because right now, if you are fully vaccinated, if you've gotten your 2 shots of the mRNA vaccines, Pfizer or Moderna, or 1 shot of Johnson & Johnson, you have a high degree of protection against hospitalization and death from COVID-19, and that's good. Again, when people reach the 8-month mark, and after September 20th is when we are going to start recommending the boosters, again, contingent on the FDA and CDC. But right now, if you're a business that's thinking about putting in requirements for vaccines, if you're a university that's considering that, nothing in today's announcement should change what you are doing, because, again, we know those requirements are going to be an important step to creating safer workplaces and schools and helping more people get vaccinated.
Although with this confusion, or sort of with the decisions that a lot of workplaces, universities and others still have to make, what do you think is going to happen if a significant share of the population ends up not getting the booster?
Well, again, I think what's important is that we put forward a plan, we get the FDA and the CDC to weigh in, and then we move forward to communicate clearly with the public about how we implement that. It's what we've done earlier in this vaccination campaign with first shots and then with second shots. It's what we'll do this time around. But we are certainly planning to work closely with the business community, with schools and universities to make sure that these guidelines are clear, that they're understood, and they can be implemented easily, because we know that this is going to be the pathway to continuing this strong protection that people have right now from the vaccine.
Shepard Smith here. Thanks for watching CNBC on YouTube.